Yeah, so I think what's really critical is we know that the vaccinations, work well, even in our patients. They get quite a high degree of protection from that. And what's important is that our current standard of cares, for example, in higher risk MDS of azacitidine or decitabine therapy alone are inadequate. And really, we need to highly focus on getting on clinical trials on new drugs, particularly both in frontline as well as in relapse refractory, where really there's no option once you fail a standard hypomethylating agent. And so I think my biggest advice would be is that we can handle this with protective measures, preventative measures. I would still highly seek out potentially new drug combinations, because again, just going with the standard of care therapy alone is inadequate. Less than half of patients responding and an average real world survival of less than 2 years. In the same setting, it's very important to be considered for allogeneic transplant. Again, this has been very safe and effective and really not impacted much by the COVID pandemic, but I think there's a lot of fear and concern, and I think hopefully some of both the data and real world experiences can alleviate that for our patients.